Sawadee Good afternoon, everyone, and welcome back to another Facebook Live session organized by Esperance Integrative Cancer Clinic, a subsidiary of Bumrungrad International Hospital, where we give confidence to manage your challenge. My name is Mira Mazahim, and I am honored to be your host for today. As for today, we'll be exploring a topic that is highly relevant for those of us who are living in the urban areas. And as we all know that living in the city, it has a lot of advantages, but it also comes with a lot of challenges, especially when it comes to our health. Whether it's their conveniences and many excitement about the urban life, they are often accompanied by issues like pollution, stress from a fast-paced lifestyle, and also like exposure to various environmental hazards. So therefore, these factors can significantly impact our overall well-being. So our discussion today will focus on improving our gut health, exploring the benefits of colon hydrotherapy, and understanding the importance of our initial immune assessment to ensure a vibrant and healthy life despite the urban challenges. So without further ado, we already have our guest for today. Please welcome our Dr. Brian Kunakom, our Naturopathic Consultant at Esperance, who will be joining and answering our questions for today. Welcome.
Sawadee.
How are you today?
Thank you so much. Good. I'm doing really well. How are you doing?
I'm very good. Thank you so much. All right, so to begin with our questions for today, first of all, how does living in the city impact our health?
So I'd like to start off with how our lives has changed over the years, because when we talk about cities, 50 years ago, it's completely different from what we see today. 100 years ago, the city is completely different from what we see today. With technologies, it seems like we're doing pretty well in terms of conveniences, but when it comes to our health, we kind of take it for granted. So what do I mean by that? When we're talking about food, how do we get food in general? Things have changed. Before we have to cook our own food. We have to hunt our own food. As our civilization advances, we realize that we can buy food from the restaurant. So the convenience comes from actually sitting in a restaurant, paying for these services. But nowadays, things are even more different because we actually have access to applications in our phone. We can order food from any restaurant, and they're basically coming on this part of the world. We'll probably call it Grab Food, other parts Uber Eats. And a lot of times the traceability is gone compared to when we're in a restaurant. We know that we can actually talk to them and say, hey, what are you putting in our food? But what we're seeing these days, all we care about is just taste. And if it tastes good, it must be good. Most of the time, our food are processed for this reason, because processed food tastes really good. For a restaurant business to thrive, right, they have to make us addicted to their food. They probably don't want to make healthy food that is not addictive. They want to make sure that we want to come back. So they have to find a way to make sure that we really love that food. We tell other people. So what would taste really good to our tongue? Most of the time that would be processed food. And that's when we start taking our health for granted, because these processed food takes a long time for us to pick up whether or not they're bad for our health. Sometimes they take years. By the time that comes, then some people say it's too late. It's never too late. It's just that we've become addicted to the taste, and it turns out that it has already impacted our health. So this is just one aspect. It's just the food. We haven't talked about pollution. We haven't talked about the ability for us to sweat, right? In urban life, when we're working, when we meet our friends, most of the time we don't want to meet them while we're sweaty. We want to meet them when we're sweaty and we're in the gym, right? So we try to make sure we don't sweat most of the time. So that sweating is actually one of the biggest detoxification factors. So with that, it all contributes to our health. But in terms of our colon, I think food is one of the biggest ones. The other one is probably like stress, where when we're talking about going to the toilet, doing a number two, we realize that we hold it in. When we go to work, if we're in a meeting, then we hold it in, right? We don't go right away, because and that's another stress factor. So when we talk about bowel behaviors, things have changed because we prioritize different things for a purpose, and that purpose is probably to be able to live with more money and comfort.
Yes. And following that, like as you mentioned about food being the biggest concern here, could you explain what gut health is and why is it so crucial for our overall well-being, especially for those living in the urban areas?
So gut health became more important probably in the past decade because we start to have more information, especially studies, that we are not, our body is actually uh, built in a way that it can allow many organisms to live, pretty much an ecosystem. We thought that our body belongs to us and everything, but it turns out that we have a lot of little critters living in there. And I'm talking about bacteria, viruses, fungi, parasites. They all live together in unison. So back then, when we're talking about gut health, all we care about is, oh, am I constipated? Am I having diarrhea? Am I having stomach aches? Or maybe am I having GERD? These are the previous meaning to gut health. But what we've noticed today is that, okay, our gut health is more related to the microbiome. Microbiome is basically all things that live within our gut. And if we have a healthy microbiome, it means that all these bacteria, funguses, and viruses, when they live together, they're living in unison and they're not causing any problem. But when one species overtakes a particular area or it overgrows, and we see this with chronic diseases quite a lot, we see a pattern. Certain diseases like diabetes, we would produce overpopulate with certain species or families of bacteria, and this becomes evident with many people with the same type of DM type 2 or diabetes. Then we start to realize that these are the population with poor gut health. Now, when we talk about disease, it's always about positive, negative. Do we have this disease or do we not? But when we talk about the gut health, we can actually see the transition along the way in these studies where, okay, if someone's about to get sick, we tend to see that the bacteria changes over a period of time. And this is what we saw in clinical trials. So nowadays, when we talk about gut health, it just means that whether or not the bacteria are living nicely together or they hate each other. So it's basically thinking about a city that we live in. I like to use Bangkok as an example because we have a lot of expats, we have a lot of tourists, we have a lot of locals. Now, if at any point we overpopulate with just tourists and the locals won't be too happy, and this happens in every country. Not that we don't like tourists, it's just that sometimes when we don't have our own space, we tend to not be happy. And this is what we see with these bacteria and viruses. If we can live all together at the same time, not disturb each other too much, and actually benefit from each other. So this is what we mean by good gut health or a healthy gut health. On the other hand, a poor gut health, which means, you overpopulate the Thai population with, let's just say, a certain nationality. So we lose the culture. And of course, that's what the local people don't like. Or maybe if we have a group of expats and we start overpopulating the expats with Thai people only, now the expats are feeling uncomfortable because it's not their language anymore, even though they're living in Thailand. So we want to make sure that everyone lives happily, right? One of
Yes.
the biggest issue that we see with that is most of the time these bacteria that lives happily together comes from the food that we eat. If we give a good environment to these bacteria, then they'll grow in a way that actually would love each other. Yeah, so that's the definition of that.
That's a very good demonstration of how we can see the picture of what's our gut health like if we overpopulate them with like bad bacteria and good bacteria. And as you mentioned about the poor gut health here, what are some of the common symptoms of poor gut health that we should be aware of, and when should someone seek professional help?
Okay, so this is probably one of the biggest or hardest question to answer, especially if someone who's young and healthy. We tend to think about constipation as something that's not too bad because uh, we can fix it with laxatives, or we will change our diet for a little bit and then we'll see that our gut health comes back. So the signs are not really there. The symptoms are not really there. Um, the only way to know is if we check from time to time, but that's just not economical. So how do we know exactly? We would know that our gut health has turned bad when we have these symptoms, such as diarrhea and constipation. That's the first thing that people think about. Now, there's a lot of things that are related to gut health. And I've noticed over the years that, and studies have shown this as well, especially in children, if someone who's allergic to something and that they're not allergic to before, and now they have rashes, now they have eczema, and we start to see that this is an indication of poor gut health. Some kind of indication, not every case, but some kind of indication. And once we start normalizing the bacteria in there using probiotics in children, we start to see that the symptoms starts to get better. So in terms of poor gut health, it's really hard to tell. We only know that we have poor gut health already. And again, these are just your common symptoms: constipation, diarrhea. Another one I want to add to the picture is probably allergies or food intolerances, migraines, very simple things that we don't think about, but it can lead up to there. Now, I don't want people to think, oh my God, I just had a migraine last night. Does that mean I have a poor gut health? Well, that's why I said this is the difficulty in understanding when do we have a poor gut health? What are the signs and symptoms? I guess if it's debilitating enough that disturbs your quality of life and you can't do something throughout your day, I think that's a good time to go seek professional help. But I think the best way is just like, think of it as you're going to school, right? When we go to school, we need to do tests. I would love to go to school without any exams, right? No grades, no exams, right? Because
Yes.
they're not important, right? But it turns out it is important to be able to know where your ranking is in school, and why you need to excel over other people and be at the 95 percentile, right? Or 90 or 100 percentile all the time. So I like to think about like as we go through our lives, these annual exams, these health checkups, they allow us to get a grade or see if we're doing our lifestyle correctly. It's not about like, oh, I don't have a disease, therefore I don't have to do annual exams. Sometimes things might show up on these annual exams, and that's we can catch it before things go south. So sometimes people might not even know that they have a polyp in their colon, right? Only
Yes.
going through at a certain age, if you go through a colonoscopy, I think the age is like 45 in some countries, and some other countries it's 50. So they start screening for colon cancer, and along the way they will find polyps. And these polyps, they're benign, meaning it won't cause cancer, but it can lead up to cancer. So you won't have any symptoms for polyps, but once you go through the exam, they might find something and they can remove it and send it out for a biopsy to make sure that it's not cancerous. And these are basically the tests that I'm talking about. Going through your annual exam, don't wait for a symptom to show up. Therefore, you know where your ranking is in terms of your health, and you can compare your ranking to the one last year and the year before. So that's how I like to look at it, instead of waiting for symptoms such as constipation. Actually, to be able to be diagnosed as chronic constipation, it means that you have to have less than 2 stool or bowel movement within a whole week, right? If you have more than that, let's just say I poop 3 times a week, then that's considered healthy and you're not constipated according to guidelines. But again, some people want to make sure they're in the 95 or 100 percentile, so they want to have a bowel movement every day. So I guess if we're going off the symptom and criteria, we pretty much say that you're constipated if you have 2 bowel movements a week. And I feel like that's a little bit too little as time goes on. That's where we start seeing gut health either on both extremes, either healthy or not healthy, right? Therefore, I think don't wait for the symptoms. Your annual exam would be a great time to actually ask a health professional or seek for help at that point.
So meaning that there's no exact symptoms, but you just gotta check your gut health often.
Yeah. So there's no exact symptoms, and that's the difficulty of that. And my patients ask me this a lot. It's like or even my friends, they come across, they're like, hey, you work with cancer patients. When do we know? When's the first sign do we know that they have colon cancer? And I'm like, usually you have blood and stool, but you have blood. By the time you have blood and stool, it means it's not a first stage most of the time. If it is, then you're lucky, right? Most time
Yes.
it's in stage 3, stage 4. So I feel like there's no symptoms to tell. It's a silent killer. By the time you know, it's a bit too late. So yeah, just seek. I guess the best way is just to be doing early screening. That's probably the best way.
So if constipation could be one of the symptoms here, what about when people are having issues like loose stool or diarrhea? Does this also like link to our poor gut health?
Absolutely. Yeah. So if you have diarrhea all the time, the bacteria probably goes in a way that favors bacteria. Most of the time, if it's too much, it can kill you. And that's where we hear about salmonella, E. coli, these kind of things that could be found in our food. Most of the people who get traveler's diarrhea tend to have an infection of some sort. That's when an infection is a good example of bacteria that overgrows or overpopulate compared to other species. So yeah, diarrhea can definitely be one of the symptoms too of having poor gut health. Definitely.
Right. So as you were mentioning about colon cancer here, when we want to like shift to another important aspect of our discussion here, can you give us another overview of what colon hydrotherapy is and what are the benefits that they can offer?
So colon hydrotherapy is just, we do this in wellness clinics. Basically, we irrigate the colon. So when we irrigate the colon, we add water into the large intestine. As you can see, the large intestine is an upside down U, right? So if we're looking at the picture, it starts from the right. The right side colon basically is where it starts for the large intestine, and eventually it goes up, across, and down on the left, and that's where feces come out. Now, when I say right and left, I'm not talking about left of me. I'm talking about left of the person, right of the person. So when water goes up, it probably goes up from the left first, left side of the colon. In this picture, it'll be the right side of the picture, but let's call it left side colon or the descending colon, right? And when water goes up, it doesn't go up all the way. Basically, it cleans up the colon, but we also have a second mechanism of the bowel where when there's something in our colon, the whole tube tends to move together. We call this peristalsis. The moment we put food in our mouth, right, the whole digestive tract is moving. And this movement is called peristalsis, allowing food to come through. So if we add something through the back end, then it's as if like it's telling us we need to go, right? We need to go to the toilet. So now things start moving along. So when we irrigate the colon, if we are able to hold water more, then the water can go up more. But if the water doesn't go up and clear, it usually doesn't go up the whole colon. What tends to happen is it cleans out just part of the colon, but the peristalsis movement allow the feces that are stuck to come right through. So in wellness, we realize that when someone is constipated or slightly constipated, and they do this colon irrigation, they tend to bring back that function. It's like a stimulating function so that it can work again. Or sometimes we might go traveling and we ate something wrong and it doesn't cause diarrhea, but it caused constipation instead because we're not used to that food, something that might be really dry. One of the biggest one is during wine tasting because wine has a lot of tannins. Tannins dry up the colon, so now the feces are stuck to the wall, and it's hard to come out. And if it doesn't come out, the colon basically absorbs and reabsorbs and releases water most of the time. So the toxins just stay there. So by doing colon irrigation, we're able to clean out the colon or things that are stuck to the wall of the colon, allowing toxins to come out and allowing our bowel movement to normalize quite a bit. So this is colon hydrotherapy, and what we use in wellness. It doesn't replace laxatives. It doesn't replace the bowel prep. It's just an optional method that people use to help with cleaning their colon.
So we use water to flush out whatever's inside. Is that correct?
Yeah, so we use just water. If we move on to the next slide, we use just water to move up the colon. As you can see in picture A, that's when water hasn't gone in yet. Picture B is when water starts going in, right? So, and picture C is when basically the water doesn't go up that high, but because there's movement, things starts to push through. And as you can see, picture D, when things push through completely, it clears up the colon. So it's just water going in. We have a nurse there with the patient all the time, making sure the water goes in. And as soon as the patient feels like, oh, I have to go, they don't have to push. They just turn on the vacuum and then things just go through using gravity and pressure, I guess, pressure from the machine. And that way it clears out the colon. And eventually we repeat the cycle of adding water, patient can't take it anymore, release the water, it goes through the machine and until the water is clear. Therefore we call that a successful treatment at that point.
Right. So if colon hydrotherapy helps with like removing toxins from our body, does this also include like heavy metals that we might be exposed to like in the urban setting?
Yeah, so in the urban setting, where do we get heavy metals from? One of which is from the water source, right? And when I say water source, I'm talking about when we water the plants. Sometimes the water has cadmium, right? That has what's the other one? Mercury. It has lead, and plants do take this up. And when we eat the plants, it goes into our gut. And most of the time when the body realizes, oh, I don't need you in our body, let's just flush it out. So it comes out in our stool. And when it comes out in our stool, the problem is if our stool is stuck in there and doesn't come out that much, then it recirculates back. So this is where having a bowel movement every day helps because it allows us to flush out the toxins pretty well. I think the biggest heavy metal I've seen in today would be arsenic. Mainly because we use arsenic originally as rat poison, but we use arsenic in pesticides quite a lot. We also have glyphosate as well. But arsenic being the main one that I see in patients when they come for a checkup. And this is optional checkups. These are not required, right? So you're not going to get this through an annual exam, but some patients, they read about it, they want to know about it. So we do see it because of the rice they eat, the grains that they eat, and mainly it's coming from the rice in this part of the world. Even though it's organic during rainy season, such as now, we start to see that from a non-organic crop, water does drain down into the organic soil. So now the soil is not organic anymore, and that's when we start seeing heavy metals such as arsenic in our food. And by the time it goes into our stool, things don't clean out that well. And if someone who is constipated, then this arsenic gets recirculated back into the system. So this is just one way of us trying to remove the toxins out through an urban lifestyle. The other one that we see is from pollution, cadmium, because it's one of the PM 2.5. Well, the moment we breathe in cadmium, it goes right into our bloodstream. It doesn't have to bypass the lungs anymore. And once it goes into our bloodstream, if we don't take it out, usually when we have fiber, it comes out. Where does fiber go? Fiber goes into our stool again, right? So I guess our stool is one of the big main ones. The other one would be sweating. If we're not sweating, then we're not really releasing toxins as much.
Yes. So basically, when we talk about the process of colon hydrotherapy here, there may be some like misconceptions and concerns regarding the safety and efficacy of the process. For example, like people may be concerned with the dehydration and electrolyte imbalances. Could you address some of these common concerns?
Yeah, so when we induce diarrhea, that's when the electrolytes become imbalanced, but the process does not induce diarrhea. And if a person is having diarrhea, we wouldn't ask them to come do this anyway. So 3 of the biggest contraindications, meaning that in people we won't do this process with, is if they just had surgery of the colon or anywhere in the lower part of their abdomen or any part of their abdomen, because we don't want to create pressure that might actually induce a tear, right? If people have these kind of surgery within the past 6 months to a year, then that's one of the things that we rule out first. Depending on what type of surgery, we can talk again and see if it's safe for them to go through this. The second one is if they have hemorrhoids that are really bad and they're bleeding all the time, active hemorrhoids, then we probably don't want to do this process to aggravate the bleeding. The third one is diarrhea. If someone who's having diarrhea, then they're clearing their bowel all the time. Adding water in will not help with anything because we add water, we clear the water. They might be even more dehydrated at that point. Inducing a bowel movement in someone who has diarrhea would induce more diarrhea. So those are the three top cases we wouldn't take. In terms of healthy people, if we're adding water in, most of the time, yes, there is a little bit of water reabsorption through the colon. So sometimes someone with really, really high blood pressure, and if it's through a lot of volume, adding water in can aggravate this. So this is something we have to screen for our patients first before having them go through. We don't want them to just think that it's safe and just go through it. I think electrolyte is something that, or when we talk about electrolytes, we're talking about water imbalance. This is probably the concern of doctors. If a patient has their own personal doctor, they might be worried about this. But most of the people that come in, the part that they're concerned about is probably how big of the tube it is or the speculum it is going in. Will it cause trauma? Will it cause any pain? Because it's kind of weird for someone who's never had this procedure or anything going up the back end before. They would feel uncomfortable about that. I think that's one of the biggest concerns. And the second to that would be pain. If I'm already like super constipated, I'm having cramps, will this aggravate my cramp? If you're constipated and the cramps are from your constipation, then you would feel relief after the treatment. You'll feel a little bit tired because it's like having a big bowel movement, right? When you see people who go in the toilet for a long time, they come out, they're like, we see this in cartoon, mainly Tom and Jerry. They come out, they feel like tired. So you'll feel a little bit tired, fatigued. We try to give you electrolytes at the end of the treatment, give you probiotics at the end of the treatment as well. So this is one of the biggest concerns. But in terms of electrolyte imbalance, I think that's more of a health professional concern. And yeah, we don't see much of that unless they're already having nausea and diarrhea, then we wouldn't do this process. We'll have them go home and rest.
I see. And what about those healthy people with normal gut health? What if they want to choose to do the colon hydrotherapy in terms of like resetting their own gut health? Is it possible or is it necessary for them to do so?
Well, to answer the last question, is it necessary? No, it's not necessary. Is it possible? Yes, right? So a lot of people do it for, I think aesthetic clinics, they do it for skin purposes, because we see that when someone who undergoes this process, they tend to clear up their skin a little bit more. And that's where I talk about like rashes, allergies, or even acne. If you are having acne all the time, it tells me that your food is not optimal. And if your food's not optimal, you might be slightly constipated and you would benefit off this treatment. Whether or not this treatment is an indication for it, it's probably not, but it will help and become beneficial. So healthy people can go through it, right? Especially those who travel a lot and they feel like, oh, this is not my type of food, and I feel a little bit weird. Yeah, this might be a treatment that could help remove things after a trip of just, I guess people call it cheat meals, or just, I'm traveling, I'm having fun, I'm having my social meal. I'm gonna go through all this food because I don't have this in my country. So that's one example, I would say. It's definitely safe. Would I indicate this all the time? No, probably not. Do they need it every single time after a trip? No. It's just that if they feel a bit constipated or if they feel like their skin needs clearing up a bit. I do talk about skin quite a lot. I don't know why, but that's the one thing that I notice in my patients who don't have a good bowel movement. They tend to have skin problems too. I just see that relationship. In studies, it's not strong to say that people who are constipated might have skin problems. It's not a strong, clear connection. but I just see it in my practice, and I think a lot of my colleagues see that too. Um,
Yes.
but it doesn't tell people to go have laxatives right away. But if you do clear your bowel, it tends to help a bit. Yeah. And
Yeah.
another case is
Yes.
um, if you're not, I guess if you don't eat fiber as much, and one day you decide to eat fiber because you read on the internet, then the first thing you'll notice is constipation and things block up because fiber absorbs water, so it gets stuck. It's a double-edged sword. So fiber allows us to take out toxins at the same time we don't drink enough water. It just bulks up the stool and it gets stuck there. And this is where the colon hydrotherapy helps quite a lot. Yeah.
I see. Actually, I heard some of the saying that even if you use a lot of beauty products for your skin and stuff, but if the inside of you is not healthy, then it doesn't really help much of how much products you're using. Is that true?
Yeah, I mean, it looks good on camera, right? But for how long before things
Yes.
start deteriorating again? A lot of times when we're talking about cosmetic products, the first thing that comes to mind is aluminum. Um, we have this in pretty much all the makeups, right? Sometimes in soap,
Yes.
sometimes in creams, and there could be a toxicity of aluminum as well. So if we reduce the aluminum amount that we use, then our body has more time to relax. Actually, in a lot of makeup books, makeup videos, not that I put much makeup on, but I do see at the end of the book, they always say, give yourself a break day from makeup or a
Yes.
day where you don't put any makeup on at all, just so that your skin gets to relax a little bit. So yeah, so I think uh, there is some truth to that where outside looks good, but is it affecting the inside or not? That depends on what product you're using. And most of the time, if we're using products that have high toxicity, then yeah, as time goes along, our body can't heal itself as fast as when we were younger, right? Then
Yes.
then our inside starts to get compromised, and eventually it creates a chain effect, making our outside look worse as well.
Wow, that's very, very interesting. And you mentioned about individuals taking fiber here. I've seen that a lot of places they're starting to sell like different forms of fiber, like powder and jelly, or even drinks. Are these actually healthy, or does it really work with all of us? Like, does it really work?
So fiber is actually pretty good for gut health because fiber is one of the biggest thing where we are able to get toxins in our body. Um,
Yes.
our bile is used to digest fat, and most of the toxins are stuck within the bile. Now, bile gets reabsorbed back into the body, so it can be reused again. By having fiber, it binds onto the bile and it goes out into the feces, right? So with this in mind, we're able to remove more toxins. However, if someone who never has fiber before because they just don't like the taste of it, I'm talking about your fruits and vegetables, right? The natural fibers, and they go for these fiber products, then it takes a little bit of time for your body to get used to it. And most of the
Yes.
uh, I guess, biggest symptom that they talk about is ever since I started having fiber, I can't go to the bathroom anymore because things are just so stuck. I'm bloated all the time. So yeah, when you have too much fiber and you don't ease your body into it, then that's what happened because it's like, whoa, what's this? Because keep in mind, it's uh, like if I like bread, right? If I live in this area where they sell good bread all the time, that's my food. And one day that bread store closes down and then they start selling, I don't know, noodles, cup noodles instead, then that's a different food from what I eat. So I wouldn't like that. That's basically like your body. It's like, okay, I'm not used to this. So it takes a little bit of time to like adjust, and your body eventually would adjust to it. And now the fiber will become beneficial where you have a bowel movement every day. Usually that takes around 2 weeks. So a
Yes.
lot of my patients are like, "Oh, I got fiber because I heard that it's good." And then the next thing they know is like, "Oh, I'm constipated now. What do I do?" I'm like, "Well, you gotta release it somehow." But yeah, so most of the time, conventional doctors would give laxatives. I also feel like that's the easiest way too. But for people who don't like to take drugs because they feel like the drugs might affect them more, then this is an option to colon hydro.
Because they could be thinking that those kind of different forms of alternative like detox ways of them could include some of like chemicals and stuff, which could eventually affect their health in the long run as well, right?
Well, I don't think these pharmaceuticals that are laxatives are meant for long-term use unless the patient's really like chronically constipated. We see it in elderly. They're meant for short-term use and usually is not that dangerous. But when we overuse them, then yeah, things start to slow down our gut, our body becomes dependent on it. We start to see a tolerance build. We have to have an higher dose. We have to have different kinds of laxatives. And the next thing you know, we're on a bunch of laxatives to be able to have a bowel movement every day. So that's the biggest problem. I've seen it with patients who take medications that induce constipation, and those tend to be your psychiatric medications. So when patients are on these medications for a long time, they tend to like the colon hydrotherapy because what tends to happen is that the laxative stops working and none of them worked at all. So now we have to induce a bowel movement, and because we're using the machine manually, then we're able to at least take part of the allow some of the bowels to come out. I mean, not some of the feces to come out, because they're so resistant to, or their body is so build up so much tolerance to the laxatives already.
Wow. Very, very interesting there. And let's move on to the topic of immune health here. So why is having a strong immune system particularly vital for those of us living in the city?
So a lot of times when we talk about gut health, it relates to the immune system directly. So if you can see in this picture, and I like to use cancer as an example because we work with cancer patients at Esperance every day. And we notice that there is a relationship between the immune system and the bacteria that lives in it. So this is a picture that shows that if you have these type of bacteria, the bacteria would be written as microorganisms. I guess that's the fourth line down. You'll see that these organisms are associated with anti-tumor or tumor suppressor, which means they're anti-cancer. We have these species, as opposed to the next slide, when we have certain type of bacteria, these would tend to increase the risk of cancer. That's because it lowers down the immune system, creates more of an inflammation. Let me give you one example. One of the most common ones that we see is if someone who has stomach ulcers, they tend to have Helicobacter pylori or pylori. And if we leave that untreated, then they start producing abnormal cells and eventually turn into gastric cancer or cancer of the stomach, pretty much. So these are some examples that may increase the risk of cancer, and we call that pro-tumoral. So when we have too much of something, it's not too good. When we have too little of something, it's not good as well. But some of the bacteria that are absolutely pathogenic, meaning that they can increase our risk of, I guess, mortality risk, would be the ones that are written on this slide across the board. And you can see where exactly it affects most of the time. And when we check the microbiome of the patient, they tend to relate to these type of cancers. So yes, when we have a poor gut health, we have a lower immune system compared to someone who has an excellent gut health. We have an improvement in immune system. We actually did a case study before, case report, I guess, on a breast cancer patient who went through treatment and she was getting a certain drug. And eventually we start to see skin allergies that could not be controlled by medications anymore. And we just didn't know where to look. It was so early in the study with the gut microbiome that we decided to check, and we realized that, okay, it does show that the microbiome supports cancer or or in other words, it lowers our immune system. So our hypothesis at that time was, what happens if we're able to change the microbiome by adding the good bacteria, right? So we decide to add the good bacteria. And it turns out that her symptoms went away. And at the same time, we noticed that her immune system improved as well. So not only that we've shown that a good microbiome leads to a good immune system, we also showed that the reversal of a bad microbiome or a bad gut health also helps the immune system improve as well. So that's what we noticed with our patients. And it turns out, fast forward 5-6 years, studies started coming out and they said, hey, this is true as well. So it's not only us who saw this, it's pretty much other parts of the world too. It's just that it's not a standard treatment, but we see this correlation. So yeah, I think there's a big connection between the immune system and the really good gut health.
And how do urban pollutants impact our immune function? Does it also link to gut health here?
Yeah, so when you say pollutants, I'm talking about water, food, air, right? Again, toxins or heavy metals, this are related to decreasing our immune system. And we can see this in the next slide. I use heavy metals such as arsenic being one of the biggest one, where it lowers our immune system. Lead also decreases our immune system. Back in the days, we get lead from bullets, right? When someone who gets shot, they get lead poisoning easily. They easily get infected. Can I have the next slide, please? And we noticed that with heavy metal, it does lower the immune system, and it can also shut down the nervous system as well. We see this in series, we see this in movies. One of the biggest one we saw with lead poisoning in bullets was probably from Dr. Strange. I think in the beginning, someone who had a bullet gone through the brain, it turns out that he's not brain dead yet, but because there's lead poisoning going on, it shuts down the nervous system. It can also shut down the immune system. Another example in a series of House MD, I'm not sure, some people might not watch that anymore because it's an old series. There was an episode on arsenic poisoning where someone who doesn't have the smell anymore, and eventually he started developing a lot of infections, and his body started shutting down. That's also one of the most extreme cases of arsenic poisoning. And that person got it in the episode because they were smoking marijuana, and the marijuana is a plant that takes up everything in the water. So if your water is contaminated, your soil is contaminated, the marijuana will bring up all the heavy metals in it. So yeah, in a way, our city does, the urban life does impact us, because it's hard to stay away from heavy metals because we're exposed to it all the time. But yes, at the same time, if we don't give time for our body to heal, our body does a good job of healing, by the way. If we sweat, if we exercise, if we minimize these toxins, then pretty much the only places where you would get heavy metals would be from breathing and from a little bit from food, right? The other sources we're able to minimize more. If you minimize processed food, that's pretty much half the work done. The other part to it is cleaning up. If you make your own food, if you're washing your own vegetables, you're washing your own rice. Fun fact, I have a lot of patients one patient who actually washed her rice 3 times with drinking water, and it turns out that her arsenic level went down. So I asked her, like, how did you get it down? Because I didn't give you anything for it. I didn't do chelation for you. And she shared this information. So I started telling my other patients, and yeah, their arsenic level went down. So use drinking water to wash the rice, use drinking water to cook the rice. And that seems to already help the arsenic level come down. And that will give you more time to heal, on top of trying to sweat more as well.
And speaking of which, what does an initial immune assessment entail, and why is it important for individuals living in the urban areas to consider undergoing this assessment? I'm sorry, could you hear me?
Back?
Yes, I could hear you now.
Sorry, I missed that last question. Sorry.
No worries. Yes, so to repeat the questions again, what does an initial immune assessment require of, and why is it important for people who live in the urban areas to consider undergoing this assessment?
So the initial immune assessment is something that we created at Esperance because we noticed that this is not part of any screening tool at all, mainly because the guidelines have shown that there's no economical purpose to checking the immune system. When I say economical purpose, it means that if you're in a certain country and we have to do screening, we have a certain amount of money, this is the healthcare system, right? We want to make sure that we want the one that's the most necessary for our patients to decrease mortality risk. So it turns out the immune system, checking the immune system does not fit for a standard guideline practice. So we realized that a lot of people, especially during COVID, everybody talks about the immune system for some reason, but nobody checks the immune system. But it turns out that we see in studies that, hey, they're using these techniques. So we decide to bring all these tests together and create a panel out of it. So if someone who's wondering, is this necessary? No, it's not. Is it going to be covered in insurance? No, it's not, because it's not economical. Therefore, they're not going to cover. I'm going to make sure that's the disclaimer. But what we've seen is when we test this all the time, it gives us another snapshot of what our immune system looks like. Because people like to say, hey, I clean up my diet, I clean this, I clean that, I changed my lifestyle, but how come I still have this disease that's related to a low immune system? That's because we never check the immune system. There's no way to test through your insurance system or through your healthcare system what your immune system looks like. But why do we choose these panels? Is because we actually saw a strong evidence, well, strong to us, strong enough for us to feel like, hey, I think we can do something with this and create another security level for people who want to know more about the immune system. This is basically part of the immune assessment. It's called an NK activity, or natural cytotoxic activity, where we see that they did an 11-year follow-up study, which means that they did it in healthy people in Japan, and they follow up 11 years later. And it turns out that, can I have the next slide? We'll see that people who have a low NK activity tend to develop cancer after 11 years. Now, comparing that to the people with a medium NK activity, it turns out that they have lower risk of cancer, and people who have a high NK activity, they also have a lower risk of cancer compared to someone who has a low NK activity. But if you have too high of an NK activity, it turns out that it increases your mortality rate. So having too high is not too good. So we want it in the level that we want. And we found this study to be pretty strong and powerful, that we realized that, hey, we can maybe use this to assess a patient's immune system. So with that, we decide to use this technique, and we've seen that someone who improved their immune system turns out to improve their overall health as well. And this is just one of the ways in which, if someone is just wondering, hey, how's my immune system doing? This could point out to say, hey, yeah, it's low, it's high, and when it's low, what can we do? If it's too high, what can we do? If it's too high naturally, then obviously we might want to check at another time point as well. But if it's too low, we can help you with that. So that's basically what our initial immune assessment is. And we develop it from a standpoint of, how can we know that our immune system is strong enough to fight against cancer? And that's basically what it answers. But it doesn't mean that everyone who has a high or a good NK activity would be cancer-free. It just tells us that their immune system is good enough. If you still have cancer, then it's probably another aspect. Another aspect being, do you have toxins in your body? We can check that too. Do you have a poor metabolic health, which is related to insulin resistance? we also can check through that. So it's not only one factor that causes cancer. Cancer is multifactorial. So removing or fixing only one factor will not always help. So yeah, that's the initial immune system that I'm talking about.
Right. And just to wrap things up before time runs out, could you share your or others' daily tips for like integrating wellness practices, such as gut health, detoxification, immune support into our routines, especially us who lives in the urban lifestyle? And what advice could you give us to maintain our optimum gut health throughout our diet, hydration, and exercises?
I guess being aware is one of the biggest tips I can give. A lot of times we're not aware of our gut health. A lot of times we're not aware that what we're eating. And I see this among my patients, even myself before. That's where a journal helps, diary helps. So it's not about like just theoretically speaking, hey, I clean up my diet because I listen to such and such podcast and I'm not seeing results. It's because maybe you're not strategizing it in a way where it's quantifiable, right? So a lot of people know, oh, I clean up my diet, I have lesser carbs because I heard that carbs are bad. Carbs are not bad. Not all carbs are bad, okay? Certain carbs are bad for sure, but not all of them, but that's another topic. The other part is, do you have enough protein? Do you have enough fiber in your diet? The carnivore people say, oh, you don't need fiber, you can still have a bowel movement. Yeah, because they remove all the processed food if you're doing a carnivore diet. Therefore, you would still have you can still have a decent, healthy gut. So I know people who avoid fiber, but I'm not saying that people should do that because most of us do eat processed food quite a lot, and fiber does allow us to detox quite a bit. And sleeping advices where we feel like, oh, 8 hours, I wake up, I feel great. I feel like that's not quantifiable enough. The best way to quantify things is actually have a monitoring system, and one of which would be your annual exam, because you can talk to a healthcare professional all the time. Second to that, quantify what you're eating, know what you're eating, how many calories. You don't have to count calories all the time, but at least having that skill to know how many calories you're eating could help save you a lot of money, and realizing that this restaurant is cheating you off with their food. What the macronutrients look like, what the quality of the food is. I think you will strategize a little bit better with your food. So those are the tips. And the main part is, once you quantify what you do, such as exercise, how many times a week, what's your goal, in terms of diet as well, what you're eating, just becoming aware of that. What's your hydration status? The last piece to that is basically have a monitoring system. Use any clinics, hospitals that know what they're doing. So I put up this last slide to show you an example of what I went through during New Year's. You can see that my NK activity looks splendid in the beginning of the at around December. Then yeah, party happens, right? Countdown happens. You're out with friends, and people tell you that alcohol will not affect your health that much, right? And I don't drink much. I drink like one glass at most. Within that 3-week time span, it was literally 3 glasses in different time points. And as you can see, a month later, I would check my immune system, and now it's below average. It puts me at a higher risk for cancer. And it took me almost a few months, I think 6 months, to be able to bring it back again without using stem cells, without using fancy machines, just lifestyle modification, making sure that I control everything. So this is one of the ways in which you can monitor, and that's what I did. And I realized that, yeah, no matter what people say about alcohol, it's still bad for your health, for your sleep, for your immune system. Even though, I'm sorry, wine drinkers as well. I tried to help you guys out, but it didn't help my health out. And this is one of the evidence I can show. Yeah, and again, all bodies are not the same, right? Sometimes some people might not have an immune system that is so susceptible to alcohol like mine. So I'm not saying that this is a one size fit all, but you have time to learn about your body. So I think it's good to strategize it, because and I think the biggest factor that I notice is the is the monitoring system, because we can get really exact with what we do in terms of our food, sleep, and exercise. But if we don't have the endpoint of how is it affecting our health, then there's really no point into understanding how long you have to keep up with having a healthy lifestyle, right? Because it's so much more fun to not have a healthy lifestyle. But I can tell you that at the end point, having a good health eventually in a long run gives you a better lifestyle, because you can think clearer, you feel stronger, and you can interact with more people. And at the same time, it also does not deplete you of your social aspect. It actually allows you to travel for longer, have more energy compared to people your age. So yeah, that's the tip I can give for everyone.
All right, thank you so much for answering the questions and sharing us some amazing tips. They're very interesting and very considerate. However, we might go through a little quick Q&A sessions here because some of our audience have some questions for you, if that's okay. So the first question is, drinking kombucha, does it really help our gut health? Does it differ from supplements?
So kombucha is a type of fermented tea. They actually use SCOBY. SCOBY is it stands for it's an acronym that I can't remember what it stands for. Sorry, but what it means is it has a combination of bacteria and fungi, and they would grow on caffeine from the tea and sugar that we feed it, allowing it to ferment. And once it ferments, it creates kombucha. And basically what we are drinking, it's life culture of these, some people call it probiotics. So how's it different from supplements? For probiotics, we know the exact dose, we know the exact species. But when we go with kombucha, we don't know the exact dose, we don't know the exact species. Which one's better? I can't compare. It's not apples to apples anymore. Because let's just say you're depleted in lactobacillus, right? Which is a type of bacteria we find in yogurt. But if you're having kombucha for it, then maybe it might not have that strain of lactobacillus that you want. Versus if you go for supplements, then you can go for just the lactobacillus. At the same time, if you have none of the keystone species after checking, and you decide to go for kombucha, I guess it gives you a more variety of bacteria or critters. So I wouldn't say one is superior over the other. But what I would take is, I know that if you're making your own kombucha, or if you're making kombucha, the SCOBY has to be able to live in a clean environment. So it's safe in terms of drinking, even though it has bacteria. But if you're lower and if you're immunocompromised due to chemotherapy, then that's probably not what I want people to take. I can share an example of how would I use kombucha in a case of my dad. My dad really loves drinking Coca-Cola or Pepsi, or in this country there's S. I need 3 brands to be able to say, to not promote one or the other, or attack one or the other. So let's just say that he drinks this every day. So I decided that all he wants is something fizzy and a little bit sweet. So I decided to brew kombucha for him, and that's definitely a better replacement than these soft drinks. So one's not better than the other. It just depends on how we want to use it in a certain situation.
Okay, and then second question, as Dr. Brian mentioned about tannin in wine, could you please elaborate more on its pros and cons?
Okay, so tannins are not only found in wine, but the reason why I brought that up is because I had an experience I think 5 years ago, where after a wine tasting event, I couldn't go to the bathroom for a long time. And it's because everything is so drying. My mouth is really dry. And that's tannins. Tannins dry things up. It's an astringent, what we call it in herbal medicine. Tannins are also found in other herbs. One of the biggest places, common places where we would have tannins is green tea or black tea. The more tannins it have, the more, I guess, drying effect it has. So in terms of someone who has a diarrhea, in the past we didn't have medications, so we have to rely on these type of foods to be able to create constipation to stop the diarrhea, right? So and sometimes tannins also have the property to detoxify by decreasing the absorption of something as well, aka glyphosate, things like that. But at the same time, it also blocks us from getting minerals from our food. So I guess those are the pros and cons of tannins, but at a small amount, it wouldn't affect you much. But if you start getting constipated, then you probably had too much tannins, and you might need to add something to decrease the effect of astringent, which is something more soothing, such as adding a lubricant in, and those lubricant would fall within the herbs that are called demulcents, such as aloe vera gel or slippery elm, things like that. Anything that's slimy, such as fiber, right? But yeah, tannins are not all bad. Tannins can be good as well, but it's just one example because I was talking about wine.
Okay, and then moving on to another questions. May I know the treatment options that are available at Esperance to boost up my immune in general?
Okay, so there's a wide variety of what we do here. If it's from the standpoint of the gut, then we definitely would talk about probiotics to help with gut health, because we know that if the bacteria is low and that's causing the immune system to be low, then probiotics would be on top of the list. But if it's just your immune system that's low, nothing else, then we tend to go for mushroom extracts, and we recheck the immune system to make sure that you're responding to the mushroom extracts. Most of the time, our body that gets the same thing over and over again, including mushroom extracts, it gets used to it. So it doesn't get stimulated anymore. So some of my patients are like, oh, how come my immune system is not increasing? I've been having this for 3 years. Well, every 3 to 6 months, your body gets smart. So it we can't outsmart nature, right? We tried to several times and it caused so many problems. So I guess the best way is to understand that our immune system does get built tolerance, and we need to change the mushroom extracts every 3 to 6 months. Those are some examples. We also have some supplements that we use either intravenously or orally. Intravenously, we used to use this in people who are malnourished. So we tend to give back such as B complex, vitamin C. A lot of people don't know that they're malnourished. So when we check, we do see these things, and that can help increase the immune system.
All right, and then last questions. What are differences between open and closed colon hydrotherapy?
Oh, so the one that we have here at Esperance is a closed system. The open system, it would be different. So closed system is what I talked about earlier. We have a machine hooked on, and we have a nurse or someone there with you all the time, because that person has to turn on and off the water. And basically when water goes in and the patient feels like, oh, I have to go now, they don't have to push or they don't have to do anything. We just turn on a vacuum, and then it pulls out the fecal matter. But the open system, you don't need a nurse to be there. The thing is set up already. There's a bed set up for you already, and there's a speculum. The speculum goes into the rectum, and basically water starts going in. The patient basically tries to hold as much water as possible, and when they can't hold anymore, then they just don't hold, I guess, but not push. Then the fecal matter will come out. So that's the open system. You don't have to have a nurse around all the time. Now, the difference is that if this is your first time going through the colon hydrotherapy, then I would suggest a closed system, because if you're doing an open system, then most of the time you can't retain water, and you don't know how much water you can retain. When you retain too much water, it will create a huge cramp, and it won't be a good experience. That's what I noticed with patients who went through the open system for the first time. But when they go through the closed system, they'll know exactly that, oh, this is uncomfortable like this. I know when to release water now. So I would say if it's your first time, go with the closed system. Then after that, the open system might be beneficial because now you'll be able to be in control. So those are the two differences. One is more private. The other one is you have someone helping.
All right, and that brings us to the end of our live sessions for today. I hope that everyone enjoyed and learned new things from today's topic, and that you also took away some valuable messages that will help you improve your quality of life. And most importantly, thank you so much for coming to join us, and thank you especially for Dr. Brian for a very enlightening discussion and for answering our questions throughout. And finally, if you or any audience require more information or interested in any of the programs, at Esperance, we are equipped with physicians and specialists to provide you with useful guidance, and that you may also request for additional information and book an appointment in advance for consultation or treatment. Because at Esperance, we give confidence to manage your challenge, like we tell you before. And before we close out today's live, please do not forget to like and share this live video to show your support for our doctor and our team. And make sure to also follow us at all of our social media platforms to keep up with the updates and detail. And as always, we look forward to seeing you once again in the next sessions. Thank you very much for today, and we'll see you soon. สวัสดีค่ะ
Thanks so much. สวัสดีครับ
Thank you